Let's get going. I am delighted to be able to introduce you all to Liz Ashwell-Payne. Liz is the Chief Exec of Orca, and Orca run international programs evaluating digital health innovations, really helping to enhance the rigor around the safe adoption of digital products. And Liz, you're going to tell us a little bit about your journey, where you've come from, what Orca are doing, and some key lessons that are really important to new innovators as they enter the scene. We've got about 30 minutes with you today, so a bit of time at the end for some questions and answers, hopefully.
Yeah, absolutely. Thank you for inviting me to join this session today. It's a real pleasure to be here on this Friday afternoon, this sunny Friday afternoon. So my name's Liz Ashwell-Payne. I'm the founding chief exec at Orca. And I've been asked to tell you a little bit about my personal journey, about what we do, and then, as Rachel said, some of my lessons learned. And I have got some slides that I'll share with you. But before I share the slides, I thought I'd just give you a little bit of an introduction to me and how I found myself at this point in my career and in this sector. So, and I'm not going to start from my first job. I'm going to start way back from when I was 15 and when I was asked at school, as my current 15-year-old is being asked, what is it you want to be? You know, we all get asked that question, and at the time I wasn't sure what I wanted to be, but I knew what I wanted to do, and what I wanted to do was help people, and that was my overriding passion. And that naturally took me into being interested in healthcare and health type roles, but I knew that I didn't want to be a doctor. And I knew I didn't want to be a nurse because I really struggle with bodily fluids, and especially blood. But I was fortunate enough to spend a couple of days with a few therapists, and I spent a couple of days with a speech therapist, and I thought, oh, this looks really interesting. I really quite like this. So I went off and I trained as a speech therapist, and I was really excited because I thought, great, I'm now qualified and I can now start seeing patients and helping people. And so day one, went into clinic, I saw 6 patients, and at the end I thought, well, that was no good. I've only seen 6 patients. What about everybody else who needed access to my help and the healthcare services and expertise I had? And this was a long time before we had computers, so about getting on for 25 years ago now. We didn't have computers in our desk or smartphones in our pocket, but I really felt passionate about really thinking, well, how can I help to see more patients? How can I get more help to more people? And it was that underlying principle that stood me all the way through my career. And what that got me interested in at the time was interested in quality improvement, stripping waste out of the process, lean methodologies, Six Sigma, care pathway redesign. And I did that for my own services and then for the whole service. And then I basically became a bit of a troubleshooter in the trusts that I was working in, going around different services and restructuring and stripping out waste so that we could now provide more access to care for more patients. And that was great. And then I went on to do that at system level and then at region level. And then it was around about that time that I started to see the rise of technology, not just in our work, but also in our lives. So as a clinician, we now had computers on our desk and access to technology. The rise of digital health had started. I started to see digital health apps. And I thought, this is really exciting, because actually what digital health gives us is an opportunity to provide access to healthcare to millions of people all at the same time without it impacting each other and without being reduced by our own capacity as an individual clinician. And that's why I got really excited. But what I also saw were the barriers to adoption. And the barriers to adoption are alive and kicking. We're slowly breaking those barriers down, but I got obsessed with those barriers to adoption. And because I was then going back out to the system to try and support the system, health and care systems, to start to adopt innovation. And I was back to being where I was as a clinician. I could only speak to one person at a time to tell them about the amazing innovations and technologies that were available. I then took a role working across Europe, and it was exactly the same. And I thought, we've got to do something different. And I got really obsessed with, how do we really unlock the potential within digital health at scale and pace? And it was that was the problem that really drove me to think about Orca and think about what a solution could look like. However, at the time, I was really happy with the work I was doing. In fact, I absolutely loved it. So I didn't plan to set up a business, but because I was obsessed with that as a problem, I spoke to anybody who would talk to me about that problem, because I was wanting to know how they were experiencing that problem. And it was actually a digital health developer in Liverpool who I was talking to about this problem. And he was saying, well, what advice would you give me to try and get into the NHS? And I was saying, you know, the problem is bigger than just your solution. It's a sector challenge. And I started to talk about the problems and what a potential solution could look like. And he said, have you wrote that down in a business plan? And I said, well, I haven't actually, because I didn't think that this could be a business. And he said, well, I think you should, and I'll put it in front of a couple of investors. So anybody who knows me knows that I'm really optimistic and a bit of a yes person. So I thought, right, go home and I'll write this business plan. So my husband's background is business, so he helped me to write this business plan, and then I sent it off to this chap that I'd met, and he sent it off to a couple of investors that he knew. And he said, oh, Liz, you'll get a phone call next Friday, and somebody will be having a chat with you about this business plan that you've put together. So I said, okay, great. I actually forgot about it, to be truth be told. I then went off and did my day job, and then Friday afternoon the landline rung, and I thought, oh yeah, that investor's phoning me. I knew that had happened while I was talking to you. The front doorbell's just gone. Let's just see if it goes again. So anyway, so I picked up the phone and a voice said, hi, is that Liz? And I said, it is. And he said, oh, it's Sir Terry Leahy. And I said, oh, okay, the Tesco's man. And he said, yes. So I said, okay. So obviously, Sir Terry Leahy was the chief executive of Tesco's, created the club card, and originally was from Liverpool. He now lives in London, but he's a real supporter of Liverpool City. And we had a Dragon's Den type conversation. After which he put the phone down, and I didn't know whether I'd done a good job or not. But the following week I got an email to say that him and a colleague, Bill Curry of the William Curry Group, again based in Liverpool, would invest in my idea. And that was about 6 years ago, and they have been on this journey with us as our investors, and they've invested 7 rounds with us. Bill is now director of the board, and they both attend all of our board meetings and are very supportive of our work, and they're very excited about the work that we're doing. And since I'm going to tell you a little bit about what we do in a second, but since we started our work, we now work in 11 countries. And we're covering and helping over 40 million citizens every day to gain access to high quality digital health tools. And so I feel that I'm now able to achieve my passion very differently to how I thought I was going to achieve it when I was 15 and even 21 when I worked as a speech therapist, but I'm still able to achieve that passion. So I'm just going to share my screen with you, and hopefully you'll be able to see that, because what I was wanting to do was just talk a little bit about what Orca do, because hopefully it'll be relevant. And Orca actually stands for the Organisation for the Review of Care and Health Apps. And the barriers that we're trying to break down, there are 5 big barriers that we're trying to break down. The first is we're trying to break down the barrier that is awareness. We currently have access to around about 370,000 digital health solutions. Orca quite often talk about apps, but when I say the word app, I'm also including web-based solutions and websites. So we currently have about 370,000 digital health apps. Every day, 5 million people download a health app, but people didn't even know that these tools even existed. The second big barrier is access. Once people become aware that these solutions exist, where do they go to find them? You might think that the Apple App Store or Google Play is a good place to start, but if you type in a word like dementia, you'll get maybe 3 or 4 products shown, but you won't get the 6,000 strong list. So access at a very fundamental level is a problem. The third and ultimate challenge is trust. Can I trust what this is going to do for me or my patient? Can I trust what the data is going to, where the data is going to be held and where it's going to be shared? The fourth big problem is governance. If I, as a healthcare professional, recommend one of these tools to my patient, can I trust that it's safe today? But what happens if it changes tomorrow and becomes untrustworthy tomorrow? That's a big risk within a healthcare environment. And the fifth big barrier is who pays, reimbursement. It's a really tricky environment to work in, particularly if you're an innovator. So those are the 5 barriers that ORCA have been working to break down. And as I said before, ORCA stands for the Organisation for the Review of Care and Health Apps, but our mission is not to review. Our mission is to get high quality digital health tools to people and patients. But in order to do that, it does all start with trust, because trust is the biggest barrier to the adoption. And so how do we build trust? Well, what we can do is look at regulatory compliance. The challenge with regulatory compliance, and many of you will appreciate this, is that regulatory compliance is particularly in the world of digital health, is quite confusing, and it's actually a puzzle. And there are 4 big jigsaw puzzle pieces to the regulatory puzzle within digital health, because there are some regulations related to data privacy, some to data security, some to clinical and professional assurance, others to user experience. And the first thing to say with this regulatory puzzle is it's not static. It keeps changing. New regulations and standards are emerging all the time. So in data privacy, we're seeing new standards emerging in interoperability and consent, for example. And so that's one of the challenges with this puzzle. The second challenge is products keep changing all the time. So what applies to what isn't just the question, it's what happens when that product changes and updates. So it's really like trying to pin jelly to a wall. But what we've seen emerge over the last couple of years are digital health assessment frameworks. And you might have heard of a couple of these. So a couple of weeks ago, NHSX launched their new DTAC standard, which is an assessment framework which is really trying to strip out some of these complexities within the regulatory puzzle and create an assessment framework that means that if you apply that framework, we can start to build trust in products that meet those requirements. In Germany, they have something called the DIGA. Across Europe, there's about 18 digital health frameworks. And these are all really helpful at jurisdictional level in helping those different countries to feel assured of products that have met that regulatory compliance. Now, as you can imagine, across those assessment frameworks and regulations, there's a lot of duplicated effort. And so what we've done at ORCA is we've pulled all that duplicated effort into the ORCA baseline review. I'll explain why it's called baseline in a second, but basically it's all the answers on a global scale that everybody wants to know the answers to. It's around about 350 point plus evaluation process. It provides, it's carried out through our review engine. So it's a manual, humans do the processing, but we've built technologies that allow us to only ask relevant questions of the product we're reviewing. And the system will also trigger a re-review every time the product updates and changes. It's also very supportive of innovators because as we go through this process, an improvement report is being generated because it is such a confusing landscape. Most innovators didn't know what they had to do and what the rules were. So we want to help innovators know very practically how to meet that compliance. And so this process is run behind the scenes for all of the different countries that we're working in. And then what we do is we then layer on top of that ORCA baseline assessment additional criteria depending on who we're working in. So you can see along the bottom, the ORCA baseline assessment, everybody needs the answers to these questions. And then you can see the different verticals. So GGZ is our partner in the Netherlands. The second one is 5 nations across the Nordic countries that we're working in. You've then got Israel, the NHS DTAC, the EU ISO, the New EU ISO standard, Health Navigators New Zealand, I could add Canada, etc., etc. And what we're doing is we're saying to an innovator, you only have to go through the bulk of the questions once, and then depending on the market that you then want to enter, we can then advise you on what the additional rules are and process that assessment on your behalf. What it also means is that there's true economies of scale, because if in the Netherlands they've reviewed a product that now the NHS want to adopt, you can see that most of that regulatory compliance has already been undertaken. So there's real economies of scale and real sharing of the data that is within there. So that's how we're working on a global scale, but supporting everybody to work together. Now, what we also do, because I said at the beginning that reviewing is not our mission, we want to tell people, we want to get these tools to people. So how do we do that bit? Well, what we do is we then create digital health libraries. And these digital health libraries can be at national level, as is the case in the Netherlands, can be at regional level or organisational level. And these digital health libraries, the reason we have lots and lots of these is because different parts of the system have different problems that they want to solve and different communities that they want to engage with. So we might have a digital health library that's focused on adults' mental health, another on childhood obesity, for example. And these digital health libraries are home branded and home targeted and promoted to specific communities to support that awareness, access and trust of products at that local level. And now people can search for and find high quality products, because at the minute 5 million people every day are downloading a lot of weak or poor digital health solutions. So we at least want to direct them to the good solutions. What we then do is we then work with healthcare professionals who have touch points with those communities, and we first of all train them through the ORCA Academy and then invite them to use this library now as a formulary to prescribe from. And that prescription can be enhanced with the procurement of these products. So we have a partnership with the NHS and a dynamic purchasing system so that parts of the system can pay for these solutions, and then at point of prescription, a payment is made back to the innovator. And that's how a true ecosystem is then developed. And we get a lot of data out of the back of these pieces of work, which locally is used to transform and adapt and move forward with their digital transformation programs. And just on an aggregated view, I thought it might be quite interesting to share just some of the high level data, particularly over the last 12 months. So this is a heat map, so the darker the colour, the more the search terms. And what we've done here is we've just shown what's been happening since this time last year. And you can see that at the beginning of COVID and lockdown, respiratory conditions were a high area of search and recommendations through our libraries. And that's because at the beginning of the pandemic, people living with asthma and COPD were really nervous about what that virus meant for them. As we moved into the lockdown, mental health, which had always been a very highly searched for and recommended area across our libraries, but that became even more important. And then towards the latter end of last year, diet and fitness, and that correlated very directly with all the public health messages about obesity and getting yourself fit in case you contracted the virus. So we've been able to share that data with organisations like Public Health England, because this has been like a barometer showing what people and healthcare professionals are interested in. And I suppose that really COVID has been a massive accelerant for digital health. So these are some of our stats across our digital health libraries. The one that I just wanted to mention there is that we've seen an increase of 6,500% in the number of recommendations of digital health tools to patients through our libraries. And what that's really telling us is that our systems are really starting to adopt and see the benefits from these tools. And actually, these three things are something that anybody working in this space really needs to think about. the things that you really need to think about is, how do you build trust in digital health? Trust is the biggest barrier. Obviously, we're doing that through our independent reviews. How do we then activate the healthcare system and our partners to be able to use the tools? We're doing that through our Orca Academy, our app libraries, and by integrating tools into the patient pathway. And then really thinking through strong governance and risk management. We're doing that by being able to recall any future products, any products that have been recommended to patients and then have found a future fault or a future risk. We're doing that by providing data dashboards and by supporting the reimbursement and the commissioning. So I said at the beginning, we're really fortunate now to work in lots of different countries. It says there, actually, I need to update this slide. So as of today, we're now working in Canada as well. We're now working nationally with the federal government in Canada, but we are working with lots of different countries across Europe, the Middle East and Australasia. And as I said before, we're now able to help more patients than I ever could as a single-handed clinician. And it's been a really privileged journey, and I wanted to share some of my lessons learned on this journey. First lesson that I had was obviously this was a real change for me from working in, first of all, the public sector. I did have my own consultancy for a time before Orca, but that was a services business. So this was now moving into a product-based business. And the first question is, well, how do you create a product and where do you start? And where you start is you start with the problem rather than the product and the solution. And I still think that's true, even though we now have lots and lots of different products. And the reason I continue to be obsessed with the problems that we're solving is because the solution and the product will keep changing. And so getting obsessed with the solution isn't ideal because you're going to have to let go of it. But getting obsessed with the problem is where you want to be, because the problem is the problem. So where do you start with a product? You start with the problem, understanding the size of the problem, who's experiencing that problem, how are they experiencing it, when are they experiencing it, and that'll start to help to define what the product needs to be. The second lesson I've had is, of course, have a big dream. And I did have a big dream, and I do have a big dream, and we're not there yet. But in order to achieve that dream, it sounds really pragmatic and really simple, but set goals and then take action. And sometimes it can feel quite overwhelming if you have a big dream, and how are you ever going to get there? And I think, I think that probably one of my, on reflection, the way in which we've achieved that is just by getting up and taking the next tiny step forward. And it's that taking action and really working towards your goals and then your dreams that will make things happen. My third lesson is to work in collaboration and really appreciate other people's skills and strengths. So one of the things that I do now is I mentor clinicians on the Clinical Entrepreneur Programme with NHS England. And sometimes I'll get asked by clinicians, should I take a degree in coding? And my answer is always, no, definitely not. Just be really good at what you're good at and find somebody who's really good at coding. But it's not just coding, is it? When I sought to find my co-founder, I wanted to find somebody who'd been a lawyer and somebody who was very good commercially, because that wasn't where my background and my strengths were. And that's thankfully what I managed to find in my co-founder, Tim Andrews. He has completely different skill set, completely different background and experience to me, and I really appreciate that. And that's how we grew our team out, actually. We grew our team by looking at what was the next big gap and finding somebody to work collaboratively with us together as a team. My next lesson has been to really invest in the culture of the team. So we've been going through quite a bit of growth just recently. So we're just at about 73, 74 people. This time last year, probably about 27. And this time next year, we'll be closer to 180. And so getting the culture right has been really important, because you get a lot of growing pains, and it can feel quite difficult when you go through these periods. And it's the culture that carries you through. And I realised this very directly, probably about 2.5 years ago, when we brought a lady in who was excellent. She had amazing knowledge and amazing skill, but after 4 weeks, she decided that she didn't want to work at Orca anymore. And I really reflected, it was around about Christmas time, and I thought, why was that? Was it something that we'd done wrong? But actually what it was she just didn't fit in with the culture. Now, at that time, we hadn't defined what our culture was. So we brought some people in to help us have that conversation as a team to describe what working at Orca meant and what the culture was at Orca. And out of that came our values. And we now recruit to those values. I'll just quickly share with you what our values are. So the first value is we have fun. And that sounds really basic and very simple, but what it really means is we're passionate and enthusiastic and mission driven, and we're committed to achieving our aim, which is getting high quality digital health solutions to people. And because we love our work, we have fun. So that's our first value. The second is trust. People have to trust us, and we have to trust each other. It's a core part of what we do, but also how we work. If we say we're going to do something, we're going to do it well. The third is curiosity. So particularly when you work in innovation, you have to be curious, and we invite everybody from the team to ask questions and be curious, and don't just take something as fact because I've said it or because Tim said it. You know, question it, challenge it, be curious. And the fourth value is collaboration. Appreciate and respect each other's differences and work together in teams. And also, as a company, we collaborate a lot with other companies and other organisations. So that's been amazing for us, just defining what those values are, because what we do now is we now recruit to those values. And what that means is when people come in and work with Orca, they know who we are, they know what our values are, and they know that they're going to fit. And so they stay with us. And I'm really glad to say that our recruitment and retention is so much better as a consequence. My next lesson is about defining success. So success is not about never falling over. Success is about always getting back up. So the trick here is we will fall over, but as long as we get up, we're being successful. My next lesson is just be true to who you are as an individual, be really clear about what your values are, and be okay with that. This next lesson is I suppose something that I've reflected on over the years, and where we live there's quite a lot of streams, and this is a photograph of a stream near to where I live, obviously not taken in recent times, taken around an autumn day. And what I've reflected on is during this journey, I've had periods of calmness and I've had periods of turbulence, and it can feel quite stressful, obviously, as you're going through a period of turbulence. And actually, this is something that happens in life. We have periods of calm and we have periods of turbulence. But one of the things that I was reflecting on is it's a bit like a waterfall. So you have periods of the calm water and then you have periods of turbulence, and that's the waterfall. But the key thing here is that it will become calm again, and the water after a period of turbulence is deeper. And that's where you get to learn. You learn more during the periods of turbulence. And this has really helped me mentally, I suppose, when going through periods of turbulence, to just know that the waters will run calm again. And I will have learned a lot through that process. This lesson is an analogy that I read somewhere, and it just really rang true. So on this journey of building and growing a company, people look at me and look at us as innovators and think, wow, look at her, she's riding a lion. And honestly, I'm thinking, how did I get on this lion? And actually what the lesson has been in learning to ride the lion and enjoy it, even though it's quite scary. So I just really like that analogy. It just really rang true for me. And then my final lesson is to always be grateful. This has been the most privileged journey, and I do feel so grateful to be able to be on it. Yes, it can be hard and challenging at times, but every day I finish my day thinking about what I've been grateful for. And on that note, thank you very much for letting me speak to you today, and thank you for listening. I hope it's been useful.
Oh, Liz, that's fantastic. And I love fun as a value. And if you're running around writing lines and pinning jelly to the wall, you've got to have some fun somewhere.
Absolutely.
As well. Fantastic. We've got a few minutes. If anyone's got a burning question for Liz, not quite sure how we're going to manage this. You can turn your camera on and wave. I think that would be the best way to see any key questions. I mean, Liz, just one really is around, for me, the changes that are happening within the NHS at the moment. You know, within Cheshire and Merseyside, we're now moving towards a new integrated care system. You know, how do we work with organisations like yours to make sure that we're not duplicating work, that we're really collaborating and holding true to all of our values?
Yeah, I mean, I think Cheshire and Merseyside is such an innovative, already pretty well connected system, actually. You know, we work with about 70% of the NHS, and Cheshire and Merseyside, I would say, is already doing an amazing job. Of course, there's always things that we can do better. But for us, we're actually working at that Cheshire and Merseyside level, and we're working with some of your partners to really establish, you know, when I showed the layers of the review, to agree what the layer on top of the NHS review for Cheshire and Merseyside is required, with a vision of being able to interoperate digital health solutions into clinical environments. And so we're doing a big project with Jim Hughes and colleagues to be able to set that. And then across Cheshire and Merseyside, we have then different distribution and digital health app libraries and professional recommendation tools that are being deployed with specific transformational change lenses. But I think one of the things, you know, from my time working in the NHS that can be really difficult for us to have time to do is just to stand back and share the learning. And, you know, I would love to be able to bring together the partners that we're working with, maybe into a forum like this, for people to share what's gone well and what's maybe not gone so well, so that everybody can hopefully pick up the opportunities and leave behind the more challenging steps that we've taken.
Well, that's another opportunity to collaborate, isn't it? So
yes.
everyone will be keen to pick up on that. James, I can see you've got your camera on. Did you do that on purpose? No. Claire, you've got your camera on. Do you have a question you want to ask, either of you?
Yeah, I'll ask a question. Thanks, Liz. That was great to hear the journey, actually, and all the kind of I guess the bumps in the road. I guess I've got a question around having an idea for a company and then having to almost bring investors in, you know, and how that felt emotionally, you know, in terms of having more people who were not part of the original idea, part of the company.
Yeah, so I think what's really interesting is I'm probably not the traditional founder, if you will, because you know, you could probably hear that I didn't have this idea because I was planning on setting up a company. I was just wanted to solve the problem, and I just was obsessed with doing that. And but I also knew that some money would be needed to help me, because I didn't have, you know, the spare cash in the bank. Unfortunately, I wasn't in that position. So when Bill and Terry said that they would invest, and I gave them a chunk of the company, it was basically a chunk of nothing because there wasn't anything there. And so I felt that that was an investment in me and it was an investment in me and my idea. And I thought, you know what? This is a gift. That's how I saw it. And I thought this is a gift to help me have a go at trying this without taking personal risk, which I suppose as a mum of two, you know, I've got a mortgage, that was probably not something that I would have been able to do. And then actually, I also saw it as a gift because those guys had been through this process repeatedly with lots of other innovators. And so I saw it as an opportunity to learn from them and for them to guide me. And they genuinely have. And they also have a great black book contacts, and so asking them to help me. And I think that, you know, that probably would be another of my lesson learned. You know, it's okay to ask for help. You can't do everything yourself, and it's that collaboration piece again, isn't it? So although they're giants really in the retail world, they don't know health, but actually I've been able to learn a lot from them and their contacts. And I think that, you know, I'm so obsessed with the mission. So long as what I do is driving towards that mission, then I feel that it's okay. So I've never felt that it's giving things up. I've always felt that it's been adding value too.
Thanks, Liz. That's really interesting to hear. Thank you.
That's great. Thanks, Liz. I think we'll have to move on to our next speaker, but we're so grateful for you joining us. Are you able to stay in the chat for a few minutes?
Yes, absolutely.
Oh,
yes. And thank you so much for inviting me. It's a real privilege.
Hopefully the first of many times coming to meet with us and talk and collaborate.